The federal government shutdown is projected to become the longest recorded in American history as we close in on day 34.
Several talking points between Congress could impact access to affordable health care as the open enrollment window opens for consideration. Our Caitlin Ashbaugh spoke with an expert. Caitlin.
Sydney, Nigel, millions of Americans will begin weighing the decision for a health care plan that fits their needs. But this year, price hikes, limited access to free assistance, and the potential expiration of financial aid are adding pressure to an already often extensive search.
The clock is ticking as millions of Americans weigh their choices, with 6 weeks to spare so their plans can roll into the new year without any holes or gaps in coverage. The cost of coverage expected to jump to around 20% on average next year. Insurers looking to cover lost revenue from healthy patients who did not receive care and the anticipated expiration of enhanced tax credits. That's financial assistance which helps Americans pay for their plans. On top of that, care costs are on the rise.
The Affordable Care Act's built where they want a big risk pool with the healthy people that are subsidizing the people that aren't as healthy altogether.
Meanwhile, a debate continues on Capitol Hill as Democrats request the extension of income-based credits. Republicans say they would wait to negotiate after the shutdown ends. Those funds were fueled during former President Joe Biden's administration, and they're set to expire this year unless the extension is approved. The Congressional Budget Office expects the number of people without health insurance to grow by millions, if not. But permanent expansion would cost the federal government $350 billion over the next 10 years. Even if the credits are replenished before the end of the window, it could take weeks to complete rates and update the system, meaning higher prices may still be in the mix.
The challenge is the Affordable Care Act helps some, but not others. And the income is the most important factor. The situation of the people here in the upstate, it matters. Their situation, all of this matters. And we need to work together. We've got to do better. The system is, it's broken.
The Centers for Medicare and Medicaid Services has a program to offer health care navigators at no cost, but in February, the funding for that program was cut by 90%. Healthcare insurance brokers like Fury are able to provide help at no additional cost.
Experts say it's good to look now at your options based on where you live and get informed on any assistance that could help you find and navigate the system with its changes. They recommend looking beyond the premium and considering any deductibles you would have to pay, what providers are included in that network, and how many prescriptions you could have covered. We'll have the resources linked on our website. Nigel, Sydney, back to you.